Hi everyone, I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and welcome to Countyline, the monthly program that features news and information about Allen County government. And I am standing on the Tecumseh Street Bridge, nearly 100-year-old structure which just a couple of years ago underwent some significant modifications and renovations. The work was conducted by the Allen County Highway Department, which has responsibility for bridges here in the county. Bill Hartman is the Allen County Highway Department Director, and he's going to talk to us a little bit about the work that the Highway Department does with regard to bridges and clear up maybe some misconceptions. First of all, Bill, thanks for joining us.
Good morning, Mike. Good to see you.
This one, as I mentioned, I think next year actually turns 100 years old. How many bridges do we have in Allen County? What kind of sizes are we talking about and age?
Currently, we have 386 bridges in our inventory that are 20-foot span and over, and they go up currently to a little over 400 feet, but as soon as we open up Maple Crest Road, we'll have two bridges there that are in excess of 900 feet long.
And you are responsible, or the Highway Department, I should say, is responsible for bridges. Is it over 20 feet? Is that correct?
20 feet, you're right, 20-foot span and over, in all throughout Allen County except on state routes.
And exactly what is the responsibility of the Highway Department? I mean, are you involved in the construction, in the renovation, in the maintenance of the bridges?
All of the above, and then we oversee the inspection every 2 years that's administered by the federal government.
So the federal government administers, but you oversee. Tell us a little bit about how that process works.
Every 2 years, we select a consulting firm that comes around and does a thorough inspection of all the bridges in an inventory, and they've got several points of reference that they check on the bridges, and then they print us an inventory book, and currently it's 2 volumes, about 3 inches thick each.
Now, from time to time, we get reports about the condition of bridges, and there are terms used that sometimes are maybe a little misleading to the public. One that we hear about is a bridge that's structurally deficient, and I know that can conjure up all kinds of thoughts in people's minds, such as it's about ready to fall through or fall down. Clear that up a little bit for us. What are some of the terms, especially structurally deficient, and what exactly does that mean?
Well, it's really a term that helps identify a bridge as being qualified for federal aid. The bridge inventory is done, there again by the federal government, and these terms are generated within that inventory. So structurally deficient or functionally obsolete are there again, those are used for and sufficiency rating, and the sufficiency rating is a score from 0 to 100. 80 and below, a bridge is eligible for rehabilitation. 50 and below, the bridge is eligible for reconstruction. And functionally obsolete and structurally deficient are just go along with that eligibility. And any bridge that was in any trouble, why we'd post a load limit on it, or we would close it. So anything that you drive on, you don't see a sign up for, is a safe bridge.
So, in other words, as you're saying, you might have a bridge that's structurally deficient. Doesn't mean that it's in any imminent danger of having major problems to it, but it's something that you want to try to address and take care of as soon as you can.
It's just not absolutely pristine, and everything ages. Everything that sits out in the weather, Mother Nature is working on constantly to take back over, so to speak.
Now, this bridge, we talked about Tecumseh Street just a couple of years ago. You folks did some major work on it. It looks terrific. Tell us a little bit about some of the work that goes into renovating a bridge.
Well, this bridge had a lot of problems. had clay backfill in the arches where it should have had sand, and it didn't have adequate drainage internally to let the water out of the arch rings, and had significant water damage throughout. And it's Indiana limestone over reinforced concrete bridge, and so we took the whole deck off. We took all the fill out. We repaired the internal arches. We added counterforts to the outside walls to help support them better. That should have probably been in there to begin with, and then we replaced all the deteriorated limestone on the bridge, and just made it as good as, probably better than new.
Well, and that's another important point you bring out, is the age of the bridges involved when they were originally constructed, no doubt, do not measure up to some of the standards that are expected today.
Right, and that's probably part of the functionally obsolete issues, because there's new guardrail and handrail standards that change yearly, and so it's hard to keep up. It would just cost millions and millions of dollars to go out and rehab every year to bring everything up to current standards.
Yeah, no doubt 100 years ago, this bridge, when it was built, was functioning properly for the kind of vehicles we had at that time, and now, of course, things have changed so much that work has to be done to structures such as this. How do you, besides the federal guidelines and the inspections, I guess, how do you prioritize, or how do you determine which bridges need to be taken care of?
Well, the inventory actually does give us a prioritization, and it does give us a guideline as far as what order replacement should be taken, and what order rehabilitation should be taken, and then they do give us suggestions on specifically what course of action should be done.
Of course, money on hand is also a consideration sometimes, but you certainly get some help from the federal government for a number of these projects.
Yeah, yes, we do, and it's extremely helpful. They fund 80% of a lot of our major projects. Recently we rebuilt the Bosick Road Bridge, and of course it's funded quite a lot of the Maple Crest project, and the Spring Street Bridge that's going to be open here in early October. It helped with that one as well. So yeah, we couldn't do what we do without the federal aid.
And as you said, it's not just in the unincorporated areas of Allen County that the Highway Department has responsibility for bridges, but also in municipalities within the city of Fort Wayne. You oversee those as well.
Yes, sir, we do.
So overall, what's the condition of our bridges in Allen County, would you say?
Well, right now, the sufficiency rating, the highest is 100. Our average right now is somewhere between 85 and 86. So we're in pretty good shape.
Well, Bill, thanks a lot for joining us and explaining a little more about the work the Highway Department does with regard to bridges, and look forward certainly to Maple Crest, the extension, when it opens up, and seeing the work that you folks have done out there. Thanks again.
Thank you, Mike. Take care.
Well, as we try to determine just how well Allen County is doing economically and what direction we're headed in, there's a great deal of statistics and numbers and data floating around. But a lot of that information has not been pulled together, and critical analysis of that provided by one source. Well, that's about to change here in Allen County thanks to a project that's being undertaken by the Community Research Institute at IPFW. John Stafford is the director of the CRI, and he's here to tell us about the Allen County Insight, which his organization is putting out. Tell us a little bit about the project itself, and also about the first issue that they have published. First of all, John, thanks for taking time to join us.
Good to be here, Mike.
Tell us a little bit about the genesis of Allen County Insight. What's the idea behind it, and how did it get started?
The Board of Commissioners, the Allen County Board of Commissioners, have been a long-term supporter of the data gathering and analysis work that the Community Research Institute does. And we thought it appropriate to try and provide a summary of that information once a quarter in a written or a more concise format for the commissioners, for the county, and really for a broader viewership of this, including economic development organizations, other county and county-wide elected officials, and the public in general, to the extent that they find this informative and interesting. This is the first edition, as you mentioned. We'll do another one in in about 2 months, we'll come out with the fall edition. This time we focused primarily on the employment picture in Allen County, both during the recession and most particularly coming out of the recession, and how we've done in comparative terms.
First question that probably a lot of people will have after they hear you say that is, we're out of a recession? Really? Explain a little bit about how it is that the recession has, from a standpoint of the economic expert, has actually ended.
The declaration of the beginning and the ending of a national recession is done by the National Economic Research Board. And they have criteria primarily based upon national gross domestic product and that falling into a negative category for a specified period of time. Usually what people sense, what you and I and our counterparts sense, is are jobs more plentiful or less plentiful now? And they don't define a recession in those statistical terms. And most recessions here in Northeast Indiana and pretty much across the country, the lag in employment goes beyond that official end of the recession. So in the United States, the recession, the Great Recession, ended technically in June of 2009. But we didn't see employment start to pick up for another 6 months. So that's pretty typical. You hear talks of jobless recoveries. Well, we have had job growth. We've had job growth here in Allen County, in Northeast Indiana, in the state of Indiana. We're certainly not back to the levels that we were pre-recession, although Allen County is getting close. And that's some of the positive news that is presented in this edition of the Insight.
In fact, as I understand it, we've had the second best recovery in the state. Is that right? That's
correct. We can look at that regionally, and our region is second only to the South Bend Elkhart area. And more specifically, in this report, we looked at how the 15 largest counties as measured by population are doing, and Allen County trails only Elkhart County in the recovery. Now, you've got to remember that Elkhart County got hit the hardest of all the counties in Indiana, and one of the hardest hit across the country. So they really were expected to have some substantial rebound, and they have. We were also hit pretty hard, not to the extent that Elkhart County was. So we had a lot of upward room to grow, and we've done that.
Well, based on your studies, what seemed to be the factors that helped us recover so well?
I think there are several. Certainly, the rebound of the auto industry has been a big part of that. Here in Allen County, certainly the addition of the third shift at the General Motors plant was critical. That was around 900 jobs, in one project announcement. That was really key. But we're also seeing it in a lot of the supply network that is stabilized. The industry is back on its feet, and we've enjoyed the benefits of that. The extent that we are significantly tied to medical care here in Allen County has helped, because that continues to be a growing sector of the economy as population ages. Healthcare is becoming more and more important, and we share in that game. So there are two of the areas that have participated greatly in contributing to the rebound.
And I should point out, we're obviously talking about Allen County in particular, but a lot of this data that you have in the Allen County Insight Report deals with what's called the Fort Wayne MSA, which is not just Allen County.
That's right. MSAs are a truer reflection of an urban economy. And for us, our metropolitan statistical area is Allen County, Wells County, and Whitley County. And both of the other two counties, Whitley and Wells, on a proportional basis, they're a smaller slice of the metropolitan economy, but they've also done well, as has Allen County. So it's been shared across all three counties.
Another topic that you touch on in this initial report is wages, income, and earnings. And I know you refer to wages as the Achilles heel of Allen County. Explain a little more what you mean by that.
We have seen over a couple of decades now a relative decline in the average wages of all of the Allen County or MSA employees compared with their national counterparts. And that then rolls up into per capita personal income, which is a reflection of people's economic well-being. And while we are doing relatively well in employment growth, getting jobs, recreating those jobs that we had lost, we've not seen a similar reduction of the gap between us and that wage gap with the U.S. Occupations. And that's of concern because it really does reflect the earning abilities of our local residents. A lot of reasons for it. We have, over the last 20 years, lost a number of high-wage manufacturing jobs. And manufacturing is doing well when you measure in terms of output. It's just doing it with a lot fewer people. So the gradual shedding of those jobs, and in the case of the recession, the not-so-gradual shedding of those jobs really plays out in lowering that relative average annual wage.
And this is something that's not just relegated to our area. This is something that's being seen in a lot of areas across the nation, but probably particularly in the Midwest.
In the Midwest, and if you had an economy that was traditionally very strong in manufacturing, and it has fewer manufacturing jobs today than it did before, if you take that high wage, relatively high wage, high number of jobs and you reduce that significantly, it's going to impact the average annual wage significantly. And you're right, we're not the only community that's experienced this. Doesn't make it any less painful, but we are certainly not an unusual situation.
So what's it going to take, in your opinion, for us to try to close that gap and to keep the jobs coming into the community?
I think a threefold approach. One, we've got to do everything we can to continue to retain our manufacturing and manufacturing-related industry sector, those companies and those jobs. They still are a huge part of our economy. Secondly, we've got to become more diversified. The Midwestern, traditionally industrial communities that have done relatively better than us have in many cases done it by growing their professional services job sectors, businesses that export a service as opposed to a tangible product outside of the community. We have some of that in the financial services industry. We have some of that in the defense communication industry, and then a lot of other scattered. But we could do more in that area, and that's tied very much to the quality of our workforce and the quality of the community. And then thirdly, we have to continue to be in the business of paying close attention to our existing employers, what their needs are, where the opportunities to grow jobs from local companies, and keep a presence up in attracting our fair share of that which is out there looking in a fairly footloose manner for location.
What about the education of the workforce here in the community? I know that's something you touched on when you presented this report to the Board of Commissioners at its legislative session, the importance of making sure that the workforce is prepared for the jobs of the future.
Right. You know, we've had in our workforce those people of working age all the way up to retirement age, as the sum of 40, 50 years worth of age variation. In many respects, our workforce today is reflective of the workforce that served us well in the 60s, 70s, and 80s. Relatively low educational attainment was acceptable, needed a strong work ethic, and that's shifting. Even in manufacturing, that's shifting to higher skill sets, more industry-recognized certifications, associate degrees, bachelor's degrees, and beyond bachelor's degrees. And our mix needs to tilt more towards the higher ends of those than it historically has. Now, that's not just dealing with what's coming out of the K through 12 educational experience today, but it's a lot of retraining, additional training for those that may have been in the workforce for 30 years and are still going to be in for another 10 to 20 years. That's a key component of it too. So a long-term effort that has a lot of components to it, but I think, and I saw a presentation yesterday where maybe 20 years ago a workforce was a factor in 1/3 of the industry location decisions. Now it's in a factor of 2/3. It is the defining asset that a region has or doesn't have.
Let's talk for just a moment about government's role in trying to help grow an economy. There's been some debate out there about some of the tools that governments can use, such as tax abatements, incentives to either try to draw an industry into a community or keep an existing business here. What's your view as far as how much government should be participating in that, and are we using all the tools available to us in the proper manner?
I'd like to portray government's role in two levels. One is doing the basics. As we deal with a safe community, as we deal with one that has good basic infrastructure, garbage is collected, utilities work, roads are maintained, all of those are really important, and they're important to individuals. Individuals run companies, individuals make location decisions, individuals live in communities. Those basics are essential, and in communities where government does the basics well, high quality, efficiently, so that they can do it at a reasonable cost, is really, really important. And sometimes we overlook that role in economic development, but we shouldn't. It's very important. And then there are the second tier, and that's the individual incentives that we do. It could be a tax abatement, it could be a low interest loan or a grant to a company, it could be providing them with very specific infrastructure. It could be making sure that we have an adequate inventory of industrial sites, something the county has been very engaged in the last couple of years. The key there is having an arsenal of tools at the ready to be used at the appropriate times to meet the prospect. And that prospect may very well be a local company here. It's not just the out-of-town company that we're trying to woo. It's more times than not, it's a local company. But being able to pull from that array of tools a set of incentives that meet that company's needs. It's not about the project fitting the incentives, it's about the incentives fitting the project.
And as you are probably very well aware, when it comes to competing out there, you better be ready pretty quickly to do what needs to be done to bring a company in, because the competition is fierce among communities.
Competition is very fierce, and you can argue and argue whether local communities ought to be competing against each other. Show me the community that's going to unilaterally disarm. Probably not going to find one, or they're in a sweet spot of the perfect climate, the perfect environment. That's not the majority of communities, and certainly is not us. We have to be a competitor, and you've got to move quickly. The process of determining which community to make the investment in is a process of eliminating communities. So they're looking for a reason to take you off the list, to shorten their list, and not being able to move quickly is one of the easiest ways to get taken off the list.
Let's get back to Allen County Insight for just a moment. What are some of the future topics that you anticipate that you'll be covering in future editions of this?
I think one of the next things we want to do is take a more in-depth look at wages, kind of various occupational categories, industry categories with wages, and how we compare with other areas, some of the historical trends. So that'll probably be the key focus of the next edition. Beyond that, we're going to try and pick a topic a quarter to concentrate on. We'll provide some of the basic information, and then we'll concentrate on one. We'll probably look at economic output. We may look at per capita personal income, again, comparing us with others. And we'll try to find some topics that don't get covered perhaps as often as they are warranted. because we've got the luxury of 2 or 3 pages here to get into in-depth in some areas.
And then, of course, every quarter you'll also be providing some of the basic data with analysis so that we know, like we said in the opening, where we are right now and what direction we're headed in.
Exactly.
Well, John, thanks so much for being with us, talking a little bit about Allen County Insight. We look forward to the future editions of this and the great information that's contained within. Thanks again. Appreciate it. And for those of you who want to view the copies of Allen County Insight, we're going to have these provided on our county website. Just go to www.allencounty.us. We will update these quarterly as they come out so that you can peruse through the data and information that's provided and learn more about the economic shape of our community. Well, for some of you out there, you may have been thinking about making a trip to a foreign country, heading overseas, whether it's for business, pleasure, for other reasons. And ever since 9/11, folks have had to take a lot of time coming up with plans for how you travel, what you can pack, what you can take on a plane, make arrangements to have all your documentation ready. One thing you may not think about is your health and what you need to do to prepare when you head to a foreign country from the standpoint of the diseases that you might be exposing yourself to, and do you have all the proper immunizations. Well, we're at the Fort Wayne Allen County Department of Health Clinic, which is located on New Haven Avenue, and they have recently begun providing a special service for our residents. It's called a travel clinic. Candy Stat is in charge of immunization services for the health department, and she also oversees the travel clinic, and she's joining us today to talk a little bit about what's involved with the clinic and how it can help you as an overseas traveler. First of all, Candy, thanks for spending some time with us.
Thank you for having me.
This is one of the things I would imagine people don't automatically think about when they're heading out to a foreign country, maybe because we take the health system we have in our country for granted and the great service that's provided. Is that what you find when you talk to people who contact you for your services?
Yes, many of them don't realize they really should be seen 4 to 6 weeks prior to departing to wherever they're going overseas. The vaccines, if they're getting vaccines, many of them take 10 to 14 days before they have an immunity. So we like to see them at least 4 to 6 weeks ahead of time.
Now, you started this clinic service back in February. What kind of interest has there been within the community? It
has increased every month. It's been very good. We see a lot of people who are traveling for mission, going out to do mission work, just traveling for vacation, whatever, people moving to other countries. And we see a wide range going to Africa and India, and we go over everything that they need while they go there.
Okay, and how do you get your information? Where are you getting information from?
We get our information off the CDC website, which is the Trap for Travel, which they update daily if there's something going on in other countries. So we look at it every time somebody calls in because there may be new updates all the time.
Now, what's involved in the clinic? You mentioned you obviously prep folks with information about the services. What else do you do?
We educate. We educate. That's our biggest thing is we like to educate. Once we go onto the CDC website and look to see where they're going, we look over everything that they may need to travel, and we review it with them. We review all the safety tips, the travel tips, the vaccines that they might need, an anti-malaria drug that they might need prior to going. And we spend quite a bit of time with them educating them for their own safety so that when they come home, as Dr. McMahon says, they bring memories and not diseases.
Yeah, that's the even more important things. Yes, you've got people who are going over there to live, but folks mainly are going over there for short or even extended period of time. But returning to this country, not only do you want them to remain healthy while they're there, you're concerned about what they may be bringing back.
Exactly, we are. So we want to prevent that in any way that we can. And the way to prevent that is keeping them updated on the vaccines that they may need to go over there and come back safely.
Now, there is an administrative fee involved, and folks need to make appointments. Contact you folks.
Correct. They need to make appointments with us. And what we charge is we do have an administration fee for each vaccine, and then each vaccine is the true cost of the vaccine to us.
Now, you've brought some of these, and we want to kind of show some of these off, because I think people would be kind of surprised at what is necessary these days. For example, this is a rabies vaccine. Now, that's very uncommon for the most part here in this country, but not so in other places.
That's true. We don't give rabies vaccine as a general rule here, but in other countries where there are animals that roam and may bite, they do require rabies vaccine, or they're highly recommended, and the CDC highly recommends those.
What other diseases do you provide vaccinations for that, again, people maybe would be surprised to hear about?
We do the Japanese encephalitis. Yellow fever and typhoid are the two biggest that we give when people are going overseas, along with the meningitis, because the countries over there have meningitis more often than here, and the measles. We frequently give the measles vaccine because the other countries have it much more than we do.
Are there particular places overseas right now that I don't necessarily want to say folks are told not to go to, but that you have greater concerns about in terms of disease outbreak that's taking place?
I would say Africa always has a big concern. You know, they just have a lot more diseases than we do. Mm-hmm.
And we talked about the administrative fee that's involved, and you say you also charge for the cost of the vaccine. Kind of give us an idea of how expensive these things can run.
The vaccine can run anywhere from $25 for the hepatitis A to $239 for the Japanese encephalitis.
And that's just the one dose. The cost of the vaccine, if you were to go to like a private doctor, are we talking about even more expensive?
It very well could be. I would say chances are very great. Vaccines are not inexpensive, right, but they are worth what we need to pay for them.
Well, especially some of these, as you mentioned, specifically, is that a specific, when it says Japanese encephalitis, is that different from regular encephalitis?
It is, and it's in a certain area, like in the Asia areas, it's there. And the rabies vaccine, it's 3 vaccines that, it's.
So they're different strains as opposed to what we might be exposed to if encephalitis here in this country.
We don't have Japanese encephalitis in our country, correct?
Okay. Mm-hmm. Okay. And you mentioned the need to do this as early as possible before you're heading out on the trip.
Yes, we like to see them 4 to 6 weeks ahead of time. That allows us, if there's a vaccine that needs 2 doses, which some of them do, or more, allows us to get them all in. Allows us, if they need a consult with our physician or one of our providers to get an anti-malaria, it allows us to get them in to see them too. So planning ahead, get this out of the way so you come back healthy.
Do they get a checkup themselves, or how does that work?
They can go to their primary care physicians and get a physical.
But that's not really the purpose of your clinic.
It is not the purpose of our clinic, but I will say in order to get the yellow fever vaccine, they have to be non-immune compromised, so that requires a trip to their own physician, because we need a script that says that.
And again, that's something you'll be able to tell them once they make the appointment to come in.
Yes, yes. We spend a lot of time with them on the phone and while we're talking to them.
And we'll also mention, these aren't necessarily things you can contact your CVS or your Walgreens or your Meijer or your personal pharmacy to get.
No, they are not. We have to get special licenses for some of them, and they are not something that you can just get anywhere.
Okay. We talked about making the appointment. Is that pretty much on a Monday through Friday basis that you're available, or?
Yes, it is. We try to make it available Monday through Friday, and we're open from 8:30 to 11:30 and then 1 to 3:30.
Any other advice that you could give for free right now to folks who might be thinking about traveling overseas in the near future?
Biggest tips, the travel tips are basic common sense, as far as food when you're in a different country. If you can't if it's not, wash it, clean it, peel it, boil it, don't eat it. Don't drink the regular water, always drink boiled water or bottled water. Big accidents over there, always pay attention to the traffic. That's one of the other things for travelers that people don't realize. That's one of the main concerns with the travelers, because we're not used to their traveling.
Can you give any advice as far as personal medications that you're taking with you overseas? I know we talked about 9/11. There are concerns about certain things you can and can't take, and I know sometimes a little leery about particular medications.
There's none that is ringing a bell with me off the top of my head, but we do recommend that they take the amount of medications that they need for the whole time that they're going to be there, and maybe even a little extra in case their plane would be delayed, which does happen when you're overseas quite a bit. Their plane can be delayed much more.
And there's no assurance that whatever medication you're taking over here is going to be available over there.
That would be correct, yes.
Okay. Well, once again, you're here Monday through Friday. How do they get in contact with you to set up an appointment?
They would call 449-3514, and that would be a direct line to one of our nurses, and we'll call them back if they leave a voicemail or if we answer it, and we'll get them going. Okay. Find out where they're going, their destination, and when they're leaving.
Okay. And again, that's here at the clinic on New Haven Avenue that the health department operates. Candy, thanks for being with us. We appreciate it. Great information, great advice, and a great service that's being provided here. But again, the important part is make sure and make that appointment well in advance of any trip that you're going to be taking overseas, and not just overseas, but even to North America and to Canada or down to Mexico or to South America, any of those countries you help out with as well.
That'd be correct.
Okay. Mm-hmm. Candy, again, thanks so much. We appreciate it.
Thank you.
And that'll wrap it up for this edition of County Line. A reminder that all of our previous programs can be viewed online through our video on demand service, and you can find that by going to our website, www.allencounty.us. I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and we'll see you next time on County Line.